Good morning, dear students. Today, our lecture will be about the complete denture duplication. We have discussed previously the many aspects regarding complete denture in terms of setting teeth, the artificial teeth in class 1, class 2, class 3 occlusal relationship, and in natural occlusion and lingualized occlusion. And the processing of complete denture in terms of flasking, packing, curing, finishing, and polishing to deliver the denture to the patient. Today, we will discuss the aims and the processing of duplicate a complete denture. Duplicate denture considered as a second denture intended to be a copy of the first denture. There are many terms and synonyms giving the same definition of duplicate denture, like a copy dentures, template denture, replica denture. The aims of the duplicate denture. Generally, the duplication of complete denture is to transfer the contours form from the old to new dentures for maintenance of neuromuscular control. Also, the modification can be done to the basic shape of the old denture should therefore be only those necessary to correct, for example, loss of fit. Sometimes patients complain from the old denture, so we need to duplicate this denture. And those considered essential by the operator, for example, a slight increase in the occlusal vertical dimension, and the replacement of the worn denture teeth. The indication when we can use complete denture, what the indication for duplicate complete denture. When it is desirable, especially for the older patients, to provide replacement dentures with improved fit, of course, similar in most aspects to those to which patients are already accustomed. It is not easy for a geriatric patient to get used to a new denture with altered polished surface contours readily. Also, if we desire to renew old, damaged, and stained denture-based material, the duplicate denture will have the appearance of being completely new. Also, if it is desired by a patient to have a spare denture, in case of accidentally fracture or loss of the original denture, the patient often are concerned about being without dentures during required repair or aligning process. So at that time, we can also duplicate a denture as a temporary denture for them. And also indicated if we need to experiment interchanging the occlusal relationship of the dentures, for example, for clinical or research purposes as well. This could be carried out on the spare denture without changing the original one. So when to duplicate denture? We are not going to duplicate a denture unless its examination reveals satisfactory findings as regards to aesthetic, physiological, and psychological needs of a patient. The denture or the dentures should be evaluated for any previous fractures, grazed lines, missing or replaced teeth, in terms of aesthetic purposes, phonetic, accuracy of fit, and of course the vertical and centric relationship. On the basis of this examination, the patient is then advised whether the existing denture should be duplicated or remade. So temporary duplicate denture were constructed for them. The production of temporary duplicate denture is sometimes carried out with the aim that this can be progressively modified if the patient's capacity to adapt is in doubt. That means the patient cannot tolerate without all denture. For example, gradual increase in occlusal vertical dimension, or if the cause of the patient's complaint is not clear, that the patient already complained, but we cannot identify the problem. For example, patient may be a denture collector. We have many patients, they like to collect dentures and to reuse it in different times to make sure that this is confident for them, they will not stay without teeth for a long period of time. This could be fabricated with low cost and with less clinical and laboratory time. Once a satisfactory appliance has been achieved, it can then be copied to produce a definitive denture. Now, the techniques for denture duplicate, a number of methods or techniques have been reported for producing a template for a duplicate or a copy denture. All these techniques are similar except in the use of the mold container, for example, or the material used at this process. Some of these methods are the duplicating flask, using duplicating flask, or using the sub-container, the using of Silicon Putty, and the agar-agar. Basically, a mold of all denture is produced in an elastic material, such as alginate or silicone putty supported in a rigid container. The wax or autopolymerized resin template is fabricated from this mold. Any necessary modification to the old denture are performed on this template denture and tried in the patient mouth before finishing the prosthesis. Now, in some of the techniques, autopolymerized resin teeth are also fabricated instead of using available ready-made molds, especially for the temporary duplicate dentures. Now, for the laboratory procedures for dental duplication, the impression of the dentures are recorded in alginate using suitable rigid container such as a duplicating flask, a modified denture flask, or a sub-container, for as example. Starting with the process, the patient have many visits before starting duplicating the denture to make sure many steps to be carried out properly and successfully. The first visit, this visit includes duplication of the old denture in autopolymerized acrylic resin, recording the centric jaw relation and the selection of the shade, size, and the form of the denture teeth is essential at this visit, as all these refer to the dental technician to be checked later on with the dimension and the profile of the patient, of course, which checked by the dentist or the practitioner. If the previous selection old denture is not acceptable by the dentist and the patient, that means if we are duplicating the complete denture, so what we can modify in the new one, it's not only the material and correcting many things. We probably have missing some resorption of the bone, the dimension buccolingually or mesiodistally. So in this term, we have different modified steps to check in progress and to continue with the dental technician. The Facebook airborne recorded is taken as well at this point, this to minimize the occlusal error that could be generated during the lab procedure for the dental technician. So all these should be checked by the dentist, agreed with the dental technician as well, and all the third degrees for the occlusal relationship using the Facebook to be checked as well. We may need as well intraoral record is also obtained in terms of detecting many issues. If we have some soft tissue to be removed or hard bony structures, we need for relief or surgical maybe appeared during the period of wearing the denture as well. So starting with the techniques for denture duplication, this technique is we will start with the duplicating flask, which is the most commonly used by the dental technician. So the denture is submerged in alginate. We have two halves, upper and lower half, so submerged upside down. This is the old denture, and then after the alginate is set, and a flush of the material on the base is trimmed with a sharp knife to have a smooth surface. Now, then the flask is then filled with a new mix of alginate from the tissue side, a new mix of alginate, avoiding any air entrapping, and the lid is closed to release all the excess material. Then after complete setting, the alginate halves are separated and the denture is removed. The original denture is removed and it is returned to the patient. So at this step, we will start our processes to duplicate the complete denture for the patient. At this point, sprue holes are then cut into the posterior border of the alginate mold. Why we are doing this step? The impression is reassembled and held together with adhesive tape. This to make easily pouring any material we request, as we need the duplicate denture will be with either wax or autopolymerized acrylic. Then for this step, autopolymerized resin then run into one of the sprue holes until it dries from the others, and to remove all the air bubbles through moving onto the other side. Lastly, the duplicate monochrome denture is removed from the flask and mounted on a suitable articulator. Of course, after removing all the sprues that used to pouring the material and to compensate the shrinkage of the material as well during the thermal setting of the PMMA. Then mounted on the suitable articulator. Then the pink colored teeth are replaced by the selected mold of teeth, of course, and we can use wax to replace that. We cannot see here in this image the original and autopolymerized resin for the upper and lower template dentures. We can notice, for example, it is made of acrylic, or it is on the left side, or it is made of wax from the right side. And the replacement of the teeth with the same size and mode, sometimes except the color, because as the age increase, that the color of the teeth will be changed. It depends on the skin of the patient as well. After this stage, now we may need to try and to check if the duplicated template is perfect or not. So at this time we have the second visit. This visit includes trying of the denture, the verification of the jaw relation and tooth, positioning for aesthetic and phonetic, a relining base, a relining or rebase impression is then obtained as in the conventional reline technique. In terms of we have changing in the occlusal vertical dimension due to the resorption of the ridge. The dentures are now processed, finished, and polished with a routine laboratory procedure as usual. The lower denture reline, we can notice it from this image as well, is the lower denture reline impression that be taken to make sure that all the details perfect to refer to the later on to the next step. For the third visit, this visit includes all the necessary clinical procedures performed at the insertion appointment of the complete denture, including occlusal adjustment, of course, if we need an articulating paper to achieve functional intercuspation. A clinical remount procedure should also be carried out to perfect the occlusion of the duplicate denture, and this will be with the third visit as well. So this was the first technique using the dental flasks. Now for the next technique, we will have the soap container. This is one of the easiest methods to duplicate anything, regardless duplicating of the complete denture. Some people using this technique to duplicate models or some sculptures or medals. So it is easy to use the soap container. Basically, the soap container should be the box is rigid, so can tolerate the processing of duplicating denture. The denture borders are modified with a green stick dressing compound inside the patient mouth, and this is actually the original denture, the patient mouth. And then submerged in alginate in a soap container. To be checked, there is a special flow of the alginate material over the horseshoe to make sure that no air bubble included within the teeth, and then to be submerged upside down to make sure that the denture is embedded in the lower part of the soap container. Now the denture invested in the lower part of the container using the alginate, and of course removing all the excess of the alginate from this part, the lower part, or the lower pore, first pore. Now the second pour of the alginate to complete the investment procedure. The soap container should be pressed from the sides to avoid its distortion without any moving, to make sure that all the alginate going through the tissue side of the denture, and wait until the material probably starting setting the alginate material. This diagram showing the line drawing showing the mold components using a soap container technique to duplicate a complete denture. The upper half of the alginate, the lower half as well, and the position of the denture teeth and acrylic resin for it. Now, after complete setting, the two halves are then opened, and the sprue holes diameter of a pencil are cut with the sharp knife. The holes are then reassembled and can be held together with elastic band. And to make sure that the elastic band should be strong enough to make sure that there is no movement can be done during the pouring procedures. After completing this process or this step, the replication of the teeth in wax by dripping of the wax on the teeth horseshoe, and wait until it is completely solidified and become hard. We can notice here, for example, the wax horseshoe representing the teeth. At this stage, the two halves were reassembled together using strong bands. We can use two techniques, either pouring wax, and we will have a duplicate complete denture made of wax, full of wax with the teeth and the record base, or we can, as in this image, pouring a sulfur resin. The sulfur resin is being poured down on the holes with light vibration to avoid any movement from the two parts, or otherwise the accuracy will be affected. While air escaping from the other side. So pouring from one side, let the other side, the excess going through the other side. Now we can place the container with the screw holes upright in a pressure pot or hydro flask. We can use hydro flask, which is called traditionally the Ivomed, and containing water and with a temperature of 110 Fahrenheit degree, and processed under temperature under pressure of 15 to 30 psi pressure for 30 minutes to make sure that the polymerization will be processed well, and to release any monomer coming from the autopolymerized acrylic, and to reduce the porosity of the denture. Now, the waxed or autopolymerized duplicate denture are then recovered from the molds, and we can notice the upper lower templates with wax teeth and self-cured acrylic resin bases at this stage. And as I mentioned previously, we can have a horseshoe teeth poured with wax and the other part with codicure acrylic, and we can have all the duplicate complete denture with made of wax. Now at this time we need to take the center correlation record, which is obtained after adjusting the wax teeth for the occlusal vertical dimension, because at this moment we have duplicate the denture, the old denture, but still we have a problem with the occlusal vertical dimension coming from the resorption of the bone. So the center correlation record is obtained, and at this stage, and then the wax teeth on one of the dentures are then replaced with the identical mold of the resin teeth. The opposing denture guides the setup in identical position to the original denture to make sure that the occlusion were replaced for the new occlusal vertical dimension at this stage. And then at this stage also we need to try to make sure everything is perfect, to continue processing the denture using other steps later on. The third technique was the using of Silicon Putty. Silicon Putty is one of the pressure material we can use. From this image on the left side, we can notice that this lady with 80 years old patient, she's an 80 years old patient. She's wearing a denture for 25 years. We can notice that there is a marked reduction in the occlusal vertical dimension from her occlusion. She's wearing, on the left side, she's wearing her denture at this stage. However, the patient is satisfied with the appearance of the old denture and wants to have similar feature in the new dentures as well. Hence, the template or duplicate denture are indicated for this patient. She is happy with her old denture, but we need to modify many things to have a fully satisfied patient with a functional denture. In her, the intraoral occlusion of her old denture suggests anterior crossbite, indicative of alveolar ridge resorption. And this is one of the indicative factors regarding the resorption of the bone. The patient happy with the denture itself, but we have a problem of misocclusion or malocclusion related to the resorption of the bone. However, extraorally, the dentures can be occluded in normal centric occlusal contacts. So the problem is we have to fix the relationship inside her mouth to make the denture functional. The silicone putty molds are produced by using also a shellac record base, were adapted on the impression of the fitting surface. The molds are then closed and filled with molten pink wax to produce the replica of the teeth, as we notice in this image. Here, we can identify the old denture on the left side, which is occluded properly outside the patient mouth, and the replica wax denture, which have on the right side. At this stage, we need to record the occlusal vertical dimension for the patient for the new or for the duplicate new denture. Manipulation of the wax replica denture on the horseshoe is then carried out to correct any errors in the old dentures, as we mentioned, the occlusal vertical dimension. Also, the upper reline impression is obtained after adjusting the occlusal plane level and the occlusal vertical dimension of the wax replica. The patient checked for the occlusal vertical dimension, and after a while we take the wash impression or the reline impression. The duplicate dentures are then mounted on a suitable articulator to replace the wax teeth with the selected mold of the teeth to make sure everything is perfect. Now, the tooth arrangement, tooth by tooth, is guided by the old denture. The placement, guided by vision. The relation of the ridges allow the new tooth arrangement to follow the original pattern. So it is the original pattern of the teeth, but the vertical dimension were corrected at this stage. The intraoral wax trying is essential at this stage to verify aesthetic, phonetic virtues of the modified duplicate denture. So from the image on the left, you can notice that the wrinkles were removed. That means the occlusal vertical dimension corrected, and with the high lip line also on the right side image, it's proper with the position probably of the new duplicate denture. Now the new dentures can be recognized as the improved version of the old denture in this image. We can notice that the flanging become different. The position of the teeth on the right side is for the duplicate denture, on the left side for the original denture, but the right side with the improved vertical occlusal vertical dimension. Now also the patient, we can notice the patient, the smiling or at the rest position. The left images regarding the old dentures versus the duplicate denture on the right side. And we can notice the difference even with the satisfactory of the patient with the new denture. At this moment, this technique also one of the easiest technique as well to duplicate a denture. However, we should put in our minds that the trying and to improving and modify the new the duplicate denture is essential for a functional and successful denture. The last technique is the using of agar-agar technique, while the dentures are suspended with a metal rod through a sticky wax sprue. After they're suspending, both dentures are suspended in the agar container. And then after melting the agar-agar to temperature between 50 to 54 centigrade, pouring the agar-agar into the agar container and leave it to set. Once agar-agar is set, the mold is sectioned through the sprue holes to retrieve the denture, and of course using a sharp knife and to make sure this will not scratch the old denture and have a definite sharp cutting. Then the mold space after removal of the denture will appear as it is in this image, and the old denture, of course, where the wax that used to make a sprue to attach to the rod metal removed and then repolished again and returned to the patient. This is for the original denture. Now the molds here, at this mold we're using autopolymerized acrylic resin and pour into the mold space to produce a template denture for modification. And this template also can be made or created by using acrylic resin or by wax. It depends on the technique that the technician use or the easiest way to use. So this is definitely probably the easiest way to duplicate, as this agar-agar is an accurate material to be used. This is all the 4 techniques that we have for denture duplication. However, we may need to duplicate parts of the denture rather than the full complete denture, whether it is maxillar or mandibular dentures. The modification for the application were needed. For example, addition of labial flange to the open face denture. Mostly we have a complete denture with open face dentures due to highly rich area. So after a while, we probably maybe have a resorption. So we need to duplicate this. And at this point, probably we have to duplicate this area by using a special material and then duplicating using cold cure, autopolymerized acrylic, using hydro flask with the pressure under pressure. The second technique probably is for the modification is the production of temporary dentures. Teeth are fabricated with the dentin colored self-cured acrylic resin before adding tissue colored pink denture based resin, and this is probably for most VIP patients who they require temporary denture until the original dentures were to be fabricated during this procedure. This a simple modification regarding duplicate of complete denture. Now also we have problems arise in fabrication of duplicate complete denture and some solutions that we have. For example, rigidity of the box. The container used for fabrication, the alginate mold, must be rigid to avoid distortion of the alginate. And of course, subsequently, the self-cured acrylic resin template can be produced perfectly. The precautions must be taken so as the rubber bands used to hold two halves of the mold must not distort the subcontainer. So this is essential when we are using a subcontainer technique. The second problem, probably the distortion of the alginate ridge itself. Immediately after pouring the wax to form the template teeth, the mold should be reassembled to check that the alginate impression of the ridge doesn't indent the soft wax. Wax is removed if necessary to avoid any possible distortion of the alginate ridge and production of the base plate without an intact all acrylic resin impression surface. The third problem, the impression of the jaw relation. These steps should be performed with utmost care. Silicone impression material is recommended for obtaining the real line impressions, as the template dentures have to be reinserted in the mouth for recording the occlusal vertical dimension and centric relation, of course. Then the fourth problem, probably the tooth position and the tissue contouring and the contours, whether the flange, the palate, the posterior palatal seal area, the frenum as well. Since the spatile positioning of the teeth and the resin contours of the polished surfaces are important for neuromuscular control, the selection and replacement of the stock ready-made teeth on the template must be undertaken with a great care to avoid any distortion, whether the dimension should be the same buccolingually, mesiodistally, and so on. This is all what we have for today's lecture. Now the quiz for the next week is, what do you think as a dental technician? Which duplicated technique was the simplest and accurate one? And of course, thank you for your attention for today, and be ready to the next lecture for the quiz and for the topic of the next lecture.